Welcome to Carolina Beat, everyone. I'm over here with Dr. Alex Thomas from Atlantic Neurosurgical and Spine Specialist. Welcome to the show, my friend.
Troy, how are you?
I'm so happy to have you here. So you ready to jump straight into it?
Let's do it.
We've got a tough one today. Alrighty, so minimally invasive spine surgery, okay? You use the term minimally invasive to describe the type of spinal surgery that you do. How are these procedures different from traditional spine surgery?
Right, so Troy, traditional spine surgery is done, everybody out there probably knows somebody who's had a traditional spine surgery. It's a big incision, the middle of the back of the spine. And those incisions are very destructive because on the way in to try to treat the pathology you're trying to treat,
yes,
you destroy all the normal supporting ligaments and muscular attachments. So while it may fix the problem in the short term, it causes a lot of problems down the road. So minimally invasive procedures use tiny little incisions, spare all the midline structures, and we can still do all the work we need to do through tiny little incisions.
Well, I'm going to get to the benefits of this type of surgery, but I assume with what you just described is why people, when they say, I've got to go in for spine surgery,
right.
Don't do that. That's the last resort.
Right.
So let's talk about this technique.
Sure.
What are the benefits?
Sure, and I hear that all the time. Patients always, they turn white whenever I tell them they may benefit from a surgery because they all know somebody who's had a bad outcome.
Yeah.
But minimally invasive techniques, they're clearly demonstrated in the literature to have less pain, faster recovery, less chance of infection, less blood loss. So it's dramatically different than the traditional spinal surgery that people are familiar with.
All right, well, let's go through the list of conditions that benefit from this.
Sure. So you can treat the same conditions that you can treat with traditional techniques. So spinal instability, degenerative disc disease, herniated discs, anything that's causing back or leg pain, we can treat with these minimally invasive techniques. So there's no difference in what we can treat today.
Okay, you just touched on back and leg pain and maybe a little bit of neck. I want to ask you, if someone has maybe had a fall and nothing is an issue at first, but then 2 months later, all of a sudden, this pain starts. What symptoms would someone be feeling if they have injured their back, but it's not immediate with the result of pain or the feeling that one would expect? Give me those examples.
Right. So a lot of people throw their back out or lift something too heavy and they have a muscular injury to their back. So that's very common. So that's going to be self-limited and resolved pretty quickly, maybe with some anti-inflammatories, ice, and rest. What you want to look out for, the red flags that you want to look out for. So the pain's getting worse. It's worse when you wake up in the morning. It's associated with fevers or chills. That can be really bad. That can indicate some sort of infection or cancer.
Really?
Yeah. But what's more common is if it starts going down your leg and you start having associated numbness, tingling, even some weakness in your leg or your foot, that's when you should start being alarmed and seek attention.
Because throwing your back out could just be as simple as mopping the floor.
Sure.
Doing the vacuuming.
Sure.
You don't have to fall down a flight of stairs.
Right.
Do you know what I mean? I remember I just recently moved and I can't tell you the next day I woke up and I'm thinking, oh my God, my back is so sore. Now, I didn't immediately think I need to go and see a spine surgeon. I went and had a massage and I felt much better.
And that's
Do you know
how
what I
it
mean?
should be. Right.
So are you saying that if you have those feelings that you should be alarmed?
Well, so these are going to be more kind of chronic issues. So it's not going to be the one-off events that you had. So yeah, it's going to be an ongoing thing that's probably progressively worsening over months to years. Those are the patients that we see. Oftentimes, the patients like you who just throw their back out after moving, we never even see them because they get better in a few days.
Do I need a GP referral to come and see you if I'm feeling these issues?
It really depends on your insurance carrier, but typically your primary care doctor would refer to us. But oftentimes patients can just call and speak to our new patient coordinators and possibly get in without a referral.
Okay, very quickly, what type of treatments can be done?
We'll start with conservative treatments, obviously, but if not, we can do minimally invasive decompressions for stenosis or herniated discs, all the way up to complex minimally invasive fusions for instability and degenerative conditions.
We appreciate you. Thanks for coming, and we're going to sit down with you more.
Great.